اوكي مش لا يعني
ألف مبروك على المؤتمر الجميل. دايما الأستاذة الدكتورة
دي الشاشه اللي بتبقى
أفكارها صراحة عالية وطبعا الأخت الفاضلة الأستاذة الدكتورة وحيدة كداي، ما اعرفش الدكتورة وحيدة فين. تمام. طبعا يسعدني النهارده ان انا اقدم اختي لها. فعلا احنا بنعيش معاهم
طبعا دكتورة سحر ويشرفني.
وفاء عزت بايونير في طبعا هيماتولوجي اند ترانسبلانتيشن، وانا شفت معاها حالات في الحقيقه بوست ترانسبلانتيشن وكان النتائج بتاعتها جميله جدا، وكان بيبقى دايما المشاكل بشوفها الحاجات النيورولوجي. واضح ان النيورولوجي له علاقه فعلا بعد الترانسبلانتيشن وبعد الادويه بالحاجات. الدكتوره وفاء هتقدم لنا هيماتوبويتيك ستيم سيل ترانسبلانتيشن اند سيريتي. هو موضوع مهم جدا والناس بتبقى عايزه تعرف هل فعلا ده هيفرق معانا ولا لا.
الحقيقه انا بشكر بشده الاستاذه الدكتوره ايمان زكي على دعوتي لهذا المؤتمر ومناقشه هذا الموضوع، وبشكر الزميله والاخت العزيزه والنائب السينيور بتاعي الاستاذه الدكتوره سحر على التقدمه الرائعه اللي هي قدمتها لي. والحقيقه بشكر كل المنظمين للمؤتمر لان موضوع المؤتمر موضوع حيوي جدا جدا ومفيد جدا جدا، والحقيقه media positive or negative effect on the community is very important. The lack of media also is very important, and this is one of the points that I will discuss. The topic is hematopoietic stem cell transplantation and the media. And the transplantation, hematopoietic transplantation, is an evolving new branch, new curative type of treatment, and the media plays an important role in this branch. Here is the types of the media: the printed media and the broadcasting media, the internet media. In the printing media, we have the newspapers, magazines, books, brochures, flyers, and the three last are very important in the field of medicine and science. Broadcasting media also affecting the television and movies, affecting things. And the main type of media that is helpful in our field and in the field of transplantation, the social media and websites. And all knows the social media, the Facebook, the Instagram, the Twitter, the YouTube, and the websites. And we have many websites for the hematology and for the bone marrow transplantation that is very effective in the transmission of the knowledge. The American Society of PMT, the European Society of PMT, the ASH organization, PISA match for the cellular therapy. And another type of internet media is the online forums, and it is very important platform to support and assist learning. It is an online place where we can comment, message, or discussion of a particular topic. It allows sharing of knowledge with other people of the same interest. So it is a very valuable topic. And the podcast, which is a series of audios focused on a particular topic. So, social media facilitates communication and the interaction via digital interface. It allows individuals to reach large audience with minimal cost through the ease of and rapid dissemination of information. Regarding the transplantation community, social media allows the engagement of learners, sharing scientific information, crowdsourcing of new ideas, building professional development, and receiving continuous medical education together with expanding personal networks. Social media is dramatically changing the access and the exchange of information. It is the gateway to access relevant sources and the communities that is very important in the transplantation. It allows providers, researchers, and patients to interact together. Also, it allows on-demand access to latest development at national and international meetings, new published research articles, facilitating networking with colleagues, participation in advocacy and community education, and promoting available trials. So these benefits are unparalleled for modern transplantation providers. So they are very helpful for modern transplantation providers. And on this social media, the communities relevant to transplant can supply all the education and the resources, not only for the primary physician, but also for nurses, pharmacists, social workers, data managers, and other personnel in the field of transplantation. Also, in the area of interest in the cellular therapy, which is very integral part of the transplantation, stem cell therapy, and stem cell. The foundation and the organization help to spread and give the resources to all the community. And also we can recall stories for patient success, for patient loss, for patient sacrifices. So these stories are very helpful, can help foster a sense of a community and among the providers and among the all the transplant. Through this social media, we can announce and promote important events. For example, hosting a workshop by National Cancer Institute. And regarding the researchers, also these organizations are very valuable. They allow to post all about new clinical trials, all recent publication, and all the research opportunities. Also, this social media can cover major journals and periodicals, so help in transmission of knowledge in the field of transplantation, which is very important, helping in improving the outcome and in the market advances that occurred in the field of transplantation. And here is the Twitter presenting many societies on it, Food and Drug Administration approvals and industry-related news can be there. And the community, the large community, change it to a microzone through this media in transmitting national meetings and the international meetings. So the media are very helpful in making the large big community into a small community. And this is the relevant handles. For example, in Twitter for the bone marrow transplantation, the professional societies, all included in this media, the American Society of PMET, European Society, the GC accreditation, the FACT is a P, and the journals, the main journals, Blood, Nature, ASCO, many journals, the research organization, and the patient advocacy organization, which is very important for patient education, for the visa match. One of the sites that is very important for donation of stem cell transplantation, that for stem cells, that is an integral part for transplantation. And without donation, there would be no transplantation. Yeah. So same here is we can transmit virtual meetings and comment and interact through these virtual meetings. And regarding the patients, as we said before, education of the patient through the whole transplantation period, from the pre-transplantation to survivorship, are very important, supplied by the organization and sites of the patient advocacy on these areas, on this media. Also, disease-specific education is transmitted regarding the transplant. And this is very important for each disease. You have a specific education areas that should be covered for the patient, for the family, and should be known even for the community to help this program. Now, public social media platform increasingly used in the field of transplantation as an effective tool for promotion of donation of stem cell via bone marrow peripheral blood stem cell, via the HLA registry is very important. Donation of stem cell through cord blood banks are very important. So promotion of donation through this media, one of the very important areas in the transplantation. So social media also very important to the public, to communicating with the family and the friends, family of the transplant patient, communicating with the recipient of the transplant, educating him about all the process of this transplant, all the complication, all the post-transplant period, and sharing this information to the family, to friends, to recipients, to donors about donation will help increasing donation in the community, and advertising about the transplantation centers in the world. So approaching the family is a key point in the process of transplantation, and it is done effectively by this social media. It is a pillar in the success of transplantation. However, we have some drawbacks to the media, that these social media sometimes is unregulated, unmonitored. So thus, at risk, we are all at risk of misinforming, mispresenting situation of or event. So the unregulated, unmonitored media can transmit misinforming, mispresenting situation, and we don't know the audience inaccessible. So this will deepen the sequence of transmitting these unmonitored, unregulated news. So we have here ethics, and we have to promote ethics about the media, ethics about the professionalism, the privacy, the confidentiality, and the information quality in this media. And now, this is my very important area, the donation of stem cells. Cord blood banking are very important. HLA registry, very important part in the transplantation. A website, the visa match, this is one example of the sites that help in promotion of donation and donor identification, screening, and donor and the process of donation. We have cord blood banks 26 years ago, and this is the story of the first patient received the cord blood bank, Fanconi anemia patient, 5 years, that is survived more than 50 years. So cord blood can help in curing, in treating many diseases. More than 70 diseases can be treated with cord blood, and about 30,000 cord blood transplantation has been done since this first one, and about 80,000 units of cord blood are available. We have both the public cord blood and the family cord blood. The family cord blood contain blood of the family-owned cells, and the public cord blood for the donated blood in the society. In the public cord blood bank, we can do related and unrelated transplantation. We need the unrelated transplantation. Sometimes it is the only cure for a patient. And then the family transplantation, and the family banks only for related transplants. So, cord blood banks increasing the frequency of treatment of malignant and non-malignant diseases. Cord blood banks are rich in stem cells, and it carries the advantage of easy collection, safe, no danger to the baby or the mother, less transmission of viral infection, less graft versus host disease, less need for full mesh. So cord blood are very important in the cord blood transplantation that is started all over the world 26 years ago. This is how cord blood is collected and how the bag of stem cell is here after collection, and how cord blood can be the hope for a patient to find matched cord blood, sometimes the only hope for a patient for cure or for life. So each family should donate their baby's blood. It's free and safe immediately after birth from the cord blood, not from the mother or not from the baby. And it is, after that, will be frozen and stored in a public cord blood for future being the match. Here is, as we said before, we have 80,000 cord bloods all over the world available for cord blood transplantation. And here is marked increase in the use of cord blood in transplantation over the last many years. This is the increase in the cord blood transplantation. And before I shift to the HLA registry, which is the other part, I want to mention that only in Egypt, we have a safe bank, that is private blood bank. And I have initiative in the military, Al-Jalaa military hospital for public cord blood bank, but we don't have national cord blood bank. And this is, I'm considering myself the media today to announce the market need for cord blood banking in a country like Egypt to save life and to cure patient in need of transplantation. The second very important point regarding the transplant is the HLA registry, also in Egypt. The HLA Registry Foundation started in 1986. All over the world, the purpose of this registry is to recruit and test potential bone marrow donors and build medical data. This medical data is the HLA registry. And when there is a patient in need of life-saving bone marrow transplantation, then we search this registry to find genetically compatible donor. So they are very important to mention unrelated transplantation. They and the National Marrow Donor Program searchable database all over the world about 30, 40 years ago, covering all the matched unrelated transplantation. Still, we don't have a registry. And again, we need to have registry. A country like Saudi Arabia started having registry since 2010, started having cord blood since 2010, and in Egypt we don't have. So the only type of transplantation in Egypt is a matched related donor, only covers 10 to 20% of the patients, and I think we need to expand this field because more than 70, 80 diseases nowadays can be treated with hematopoietic stem cell transplantation. And this is how registry is done, the HLA registry. And joining the registry isn't easy. Only to do the HLA match, a swap from the buccal, from the sheep to do the HLA match. Then this patient is put on the registry, he's a match, and this donor should be stay committed when needed, and there will be search when there is a patient in need of these stem cells. And to donate, we have two types for donation, the peripheral blood stem cell donation and the bone marrow donation. Here is the ways to donate peripheral blood or stem cells together with the cord blood. And there is how happy the donor and the recipient regarding the presence of match, how they are happy. There is a cure for this diseased patient. There is some myths and facts about the transplantation, about the donation. Some consider the donation is very risky, dangerous process, causing severe pain. Actually not. Donation less painful than you expect. And sometimes TV movies exaggerating the pain with bone marrow donation, sometimes reaching up to paralysis. And this is not the fact at all. Some only there is some pain at the site of bone marrow collection, maybe some bruises, headache, fatigue. This is for a few days, for weeks with bone marrow transplantation. And this is how the bone marrow is collected from the posterior superior iliac spine. Another important point is a donation with peripheral blood stem cell is like donating plasma. It's an easy method, it's not dangerous, without with minimal side effects or no side effects. And this is how happy donating this girl is the stem cell, and this is a bag of stem cell that will be a cure and saving life for a patient. And as we said before, more than 70 diseases can be treated with transplantation, and donation is very important. Education of the community for the donation is very important. And here is on the top of the list of the diseases that can benefit of the transplant is leukemias, lymphomas, and immune deficiency diseases, benign hematology diseases like aplastic anemia, thalassemia, sickle cell disease, and recently adrenoleukodystrophy, metachromatic leukodystrophy, metabolic diseases like Hurler disease, and others. So many diseases will benefit of the transplantation. And here is how transplantation is the new treatment for an old disease. So it is evidence-based guidelines. That is, transplantation is the first line of treatment of thalassemia patient nowadays. It is not transfusion. So we have to encourage the community and the awareness of the community regarding the first line of treatment of thalassemia patient. Raise the awareness of the medical community totally, completely, with the importance and cost effectiveness and benefit of the transplantation in a patient like thalassemia patient and sickle cell disease patient, and early referral of those patients before iron overload, before complication of alloimmunization or fermented transfusion, before sickle cell stroke, splenic crisis, and other complications that affected the outcome of the patient. Early referral will be very important in those patients. Also, stem cell transplantation plays very important for relapsed lymphomas, and also early collection of stem cell is very important before chemotherapy can kill all these stem cells. Leukemias, high-risk leukemia, benefit of the transplant, and relapsed leukemia. Sometimes the only hope for a relapsed patient with myeloid leukemia is transplantation. So here is Fanconi anemia. Early treatment before also alloimmunization and the transfusion carries very good promise to those patients. Immune deficiency before repeated infection. Very early in life, you can transplant immune deficiency. Please don't wait for 2-3 years. Don't, this is one of the very important knowledge that should be spread in the community, in the between doctors, that is general professional. That is early referral of a patient with severe combined immune deficiency. All other immune deficiency before infection is very important for the outcome of transplantation, and it is cure in those patients very early. This is day-night transplantation for this patient. Then this is the Hurler syndrome, and how bone marrow transplantation help those patients and keep their mentality and prevent further damage to them very early in life. This is Hurler, and this is the metachromatic leukodystrophy, adrenal leukodystrophy, very early before neurological damage also is very important. Those patients benefit of the transplantation, many trials. And by the way, all the previous lists are put on the evidence-based guidelines. First line management to them is bone marrow transplantation. And osteoporosis, this is the marked damage to those patients, fatal disease. Early transplantation is life-saving. And by the way, the cure is high. The cure in those patients is high. Okay. Another 2 minutes, please. Another 2 minutes. Okay. Can a child donate? Can a child donate? Yes, very easy. And we have many childs all over the world. Child can donate from 10 kilos, can donate peripheral blood and whole marrow blood. A child can donate. And I talk about the breaking news in Egypt before, and I talk about the early referral of those patients to transplantation and awareness of the community for this transplantation. And in conclusion, I think media regarding the hematopoietic stem cell transplantation are very, very valuable for the beginners, for the providers, for the community, for the patient, and thank you.
ده حاجه عظيمه جدا. لان حضرتك انا على فكره مره عندي بقيت محطوطه اللي فيه ستيم سيلز if you want I think انه ممكن.
So I said that there is safe bank. This is one private bank. This is 20 years ago. And by the way, we have transplanted one cord blood patient, and he's 10 years living in a very good condition. This is the safe bank. And there is the public military, Al-Gala military hospital, starting the cord blood bank last year. But this is a starting initiative. We need broad spectrum national public cord blood bank all over the country to help people, to help this transplantation field that is very important, like saving for children.
ممكن اعلق بس حاجه واحده، هي مشكله البنك في مصر ان احنا محتاجين الكهرباء ما تقطعش، محتاجين ان احنا يبقى عندنا ماينس 70 له ريجوليشن. على ما اعتقد هي دي مشكله البنك، مش مشكله سعر العينه او الترجمه.
لا I think for a temperature minus 70, we have big refrigerator even in Ain Shams University to collect stem cell. Any stem cell is collected and
ومنتين دايما يوميا بتكلم على 20 سنه بحتفظ بيها.
yes,
بعض الناس.
yes, this is the way for autologous transplant. We have big refrigerators for maintaining and containing stem cells. In our hematology bone marrow transplantation unit in Ancients, and it is full, and we need another unit, and we keep it for many years. And after some time, we use this stem cell for the patient. So this is not the point for cord blood banking. This is not the point. شكرا. احنا بنحفظ عندنا هنا for private family public long term how long I don't know but forever family banks should maintain the cord blood until the family told I don't need it, please discard. No, this is private for the blood bank for families. I'm telling about the safe blood bank. Safe blood bank. Dr. Hisham Isa, this is Rasum, yes, for the first year 8,000, and for the coming years in total 32,000. 32,000. This is very good. Yes. Yes. There ممكن يعني after collection there is a screening for infection, there is the viability, the stem cell count in this amount, and then maintain it. So all these tests should be done before storing this cord blood, before freezing. So this is very important point we have to screen. And أنا مش عارفة what is Sure, the transplantation reverses isolation and the isolated room for 30 days all over the duration of transplantation. The patient should stay in this reversed isolation with laminar flow, with HEPA filters, with everything. The contact is with the doctors, nurses. There is controlled with complete sterilization, with masks, with complete gowns, with everything. This is the way. No. transplant in outside is like the transplant in Egypt. I attended transplant in USA, transplant in UK, and we are running a transplant service in Egypt. About 10 years for the pediatrics, 20 years for the adults, and about 40 patients transplanted of the pediatrics. And we are 80% success rate, and we are using these transplant units. We are using them. We don't use radiation for children, but we are using a conditioning regimen that ablate the marrow, that ablate the immunity, and then we give the stem cells and follow the patient until recovery of the counts, and then discharge the patient with follow-up for minimum of a year. The first 3 months is the most important in duration.
وممكن كلام حضرتك يبقى أول حاجات اللي بتتقدم في الموضوع يبقى
شكرا شكرا.
أنا أحب أشكر الدكتورة إيمان زكي والدكتورة عزة